Good morning. I apologize for being late. Today I will give an update on our vaccine distribution, some comments on the same-day travel, self-isolation, the reading week and March break, and some further easing of public health measures and COVID-19, both in PEI and Canada. In PEI, there is one new case of COVID-19 to report today. This individual is a male in his 30s who tested positive in another province. He currently is not in PEI and will complete his 14 days of self-isolation outside of Atlantic Canada. We currently have 4 active cases. Since the pandemic began, I think we've had 114 cases of COVID-19. Worldwide, there have been over 106.5 million cases and 2.3 million COVID-19 related deaths. In Canada, there have been over 808,000 cases and over 20,800 deaths related to COVID-19. But the trends in Canada in the past week are encouraging. New cases and deaths are both down 21% compared to the previous week. All provinces and territories reported a decline in cases in the past reporting period, and there are fewer active cases in the country. And the number of recovered cases surpassed the number of new cases in the last week. Hospitalizations and ICU admissions are also down. Healthcare services in areas of Canada with the highest rates of COVID-19 infection continued to experience significant burden and strain on these resources. Despite hopeful signs in Canada, there continue to be outbreaks in high-risk populations, including hospitals, long-term care facilities, and workplaces, highlighting the importance of keeping public health measures in place and not easing restrictions too fast or too soon. The rising incidence of COVID-19 variants is concerning. We know the variants of concern could rapidly accelerate transmission of COVID-19, and we are learning more about the transmissibility of the variants and their ability to cause more severe illness. While it is natural for viruses to mutate, it is incumbent on us to roll out the vaccine as quickly as possible. The faster we can immunize individuals, the more likely islanders will be vaccinated before they are exposed to one of the variants. So as we speak about vaccines, over 2,500 islanders age 80 and over living in the community have booked their appointments to be immunized against COVID-19. And these immunization clinics will begin later this month. Some 1,700 registered rotational workers, including truck drivers, will be contacted soon to begin booking their COVID-19 immunization appointments. Only those rotational workers who are registered with our office will be contacted for an appointment. Any rotational workers or truck drivers who are not yet registered can do so on the provincial website or by calling our office. Adults living in congregate living settings, such as shelters, group homes, and community residential care facilities, are being offered the first dose of vaccine beginning later this week. Healthcare workers who have direct patient care with or without COVID, who work in areas with limited or reduced capacity and are essential to health system capacity, such as in the OR, cancer treatment, dialysis, will also be vaccinated in this quarter and will be vaccinated as soon as possible. Community health nurses in Abbotsford and Lennox Island First Nations are leading the planning of vaccine clinics for adults in their communities. And Health PEI and our office are also collaborating with the Native Council of PEI to plan vaccine clinic opportunities for Indigenous adults who are not part of Lennox Island or Abbotsford First Nation. As noted previously, PEI received a smaller shipment of Moderna vaccine last week, 700 doses compared to 1,200 doses, which we initially expected. But weekly shipments of Pfizer vaccine are confirmed for the next 3 weeks, and we are awaiting confirmation of the shipment schedule for the rest of March. As of Saturday, 8,828 doses of vaccine were administered, including 3,517 second doses. Once again, I ask for your patience and understanding, as it will take months to immunize all islanders, and there will be vaccine for everyone. Until we achieve herd immunity, where at least 75% of our population is immunized, we will continue to focus on vaccinating as many people as we can, as fast as we can, based on our supply of vaccine. In addition, we will continue with our basic public health measures such as physical distancing, hand washing, wearing a mask in public places, keeping our circles small, avoiding non-essential travel, and staying home when sick. As I noted last week, there have been many inquiries regarding the same-day travel self-isolation exemption. Going forward, activities that will qualify for the same-day exemption include medical appointments, custody arrangements, drop-off and pickup of people, but not personal goods. And examples of those activities that will not qualify, including interviews, meetings, and picking up of personal goods. Beginning tomorrow, on Wednesday, February 10th, there will be a supervised drop-off pickup location in Borden. This site will be the location where goods, including pets, can be exchanged. For work-related activities, including couriers, provided you are not entering workplaces, homes, and are interacting with people, you will be exempt from self-isolation. If it is necessary to interact with people or enter workplaces as part of your work outside of PEI, you are not eligible for an exemption, and you can apply to work isolate upon returning to PEI. Individuals who provide frequent commercial courier services outside of PEI are asked to register as rotational workers. Subject to no substantial change in our number of cases, beginning on February 16th, the following public health measures will be eased. High-intensity activities in gyms and fitness facilities such as spin, hot yoga, and boot camps will be required to maintain at least 2 meters of physical distance instead of 3 meters. Personal services can be provided on a walk-in basis, provided the business has a robust operational plan. Our office will work with selected large venues, including Credit Union Place, the Eastlink Center, and Confederation Center, and other large facilities, regarding increasing gathering limits, provided there are separate entrances and exits, separate washrooms, and no mixing of cohorts. Venues are required to submit a new operational plan that must be approved by our office in order to have more than the four cohorts of 50 people. Provided long-term care staff immunization rates in individual facilities are at least 75%, we will be prepared to move to a third partner in care and allow more staff movement between facilities. Self-isolation is key in limiting the transmission of COVID-19. Similar to other provinces, it has been acceptable for islanders to isolate in homes with other people, provided certain conditions are met. It is preferable for individuals to self-isolate in accommodations that are separate and apart from others. If this is not possible, an excellent option is for the entire household to isolate together for 14 days. Recognizing it may not be possible for everyone in the home to person in self-isolation to be in the same room, even if physically distant with someone else in the home. Sharing of a kitchen is not permitted. The person on self-isolation must have food dropped off to their room. And if it is necessary for a person in self-isolation to share a washroom, extra cleaning and sanitation of that space is required. The provincial website will be updated soon with new information about self-isolation, highlighting the importance of self-isolation plans. Testing is also a key pillar of our strategy to limit transmission of COVID-19 in PEI. Effective immediately, when possible, I ask rotational workers and truck drivers to wait to receive their first negative test in PEI before joining their families. There are times when it will not be feasible for rotational workers to wait for their first negative test. Although not a legal requirement to wait for their first negative result, I ask that rotational workers continue to use their judgment, and when it is possible to wait for your first COVID-19 test result, to please do so. Along the same line, individuals approved for work isolation, whenever possible, should wait for their first negative test result before going to their workplace. Waiting for a negative test result greatly reduces risk of transmission of COVID-19 and ensures that workers who are not workers who are not positive, infectious, and asymptomatic for COVID-19 will not inadvertently spread it to others, including their loved ones. As a point of clarification, international travelers coming to PEI after non-essential travel and who are subject to the federal requirements for testing and up to 3 days of hotel isolation where they land, if they test negative and are approved to travel to their final destination, they will be required to isolate for another 14 days here in Prince Edward Island and be tested regularly. Students enrolled in post-secondary studies will soon be enjoying Reading Week. Similar to the Christmas season, it is strongly recommended that island students studying at post-secondary institutions off-island to not necessarily travel home for Reading Week. Any students who do come home for Reading Week will be required to self-isolate for 14 days or however long they're in the province, whichever is shorter. In the case of students from other provinces who are studying at PEI post-secondary institutions, the same message applies. Please do not travel off-island for Reading Week. Instead, consider using the time, of course, to explore the province, pursue recreational activities, focus on your studies, and also get some rest. For island families who are looking ahead to March break, now is not the time to travel off-island for non-essential purposes. I do not anticipate that advice changing before mid-March. Again, please consider exploring PEI and supporting local attractions and businesses this March break. I'm asking islanders to not travel off-island unless it is necessary. Now is not the time to be traveling domestically or internationally unless it is for urgent or necessary purposes. And I know we've been asked, and the premiers in Atlantic Canada will be having discussions about when the Atlantic bubble may be able to reform, and certainly it is hoped that that could take place by the 1st of April, knowing that things within a day can change or a phone call can change that. The World Health Organization recently commented that with the COVID-19 pandemic, we are not all safe until everyone is safe, highlighting the importance of COVID-19 immunization worldwide. In our province, with the support of Health PEI, we will continue to vaccinate people as fast as we get doses. Until we achieve herd immunity in PEI, we will continue to take a cautious and measured approach to resuming normal activities. As we've noted before, some people want the measures to be eased more quickly, and others want the process to be slower. I know it is part of our responsibility to provide balanced advice, balancing risk of COVID-19 importation and transmission with the need for society to function as normally as possible and wanting to avoid prolonged, large-scale lockdowns. As a province, we have to steer a steady ship through this global pandemic. We will continue to keep our hand on the wheel, making adjustments as necessary with the aim of keeping COVID-19 out of our province, and when we do get cases, to work efficiently to limit transmission. So as we continue to navigate our journey with COVID-19, let us continue to be patient and continue to be kind. Thank you. And I may just make a couple remarks in French before we turn that over. Bonjour, à l'île du Prince-Édouard, il y a un nouveau cas de COVID-19 à annoncer aujourd'hui. Cette personne est un homme dans la trentaine qui a été testé positif dans une autre province. Il n'est actuellement pas à l'île du Prince-Édouard et terminera ses 14 jours d'auto-isolement à l'extérieur du Canada atlantique. Nous avons maintenant 4 cas actifs. Depuis le début de la pandémie, nous avons eu 114 cas de COVID-19 dans la province, mais aucune mort ni hospitalisation. En date de samedi dernier, 8 828 doses de vaccins avaient été administrées, dont 3 517 deuxièmes doses, et plus de 2 500 insulaires âgés de 80 ans et plus habitant dans la communauté ont pris rendez-vous pour se faire vacciner contre le COVID-19. Et ces cliniques de vaccination commenceront plus tard ce mois-ci. Environ 1700 travailleurs en rotation enregistrés, y compris des camionneurs, seront bientôt contactés pour commencer à prendre leur rendez-vous pour se faire vacciner contre le COVID-19. Et les adultes habitant dans les milieux de vie collectifs, comme les foyers de résidence, les refuges et les foyers de groupe, se voient offrir la première dose de vaccin plus tard cette semaine. Et les infirmières en santé communautaire des Premières Nations d'Abergwet et de Lennox Island dirigent la planification des cliniques de vaccination pour les adultes dans leur communauté. À l'avenir, les activités qui seront admissibles à l'exemption le jour même comprennent les rendez-vous médicaux, faire un déplacement lié à la garde d'un enfant, déposer ou ramasser une personne, mais pas les biens personnels. À compter du mercredi, le 10 mars, alors demain, il y aura un lieu de dépôt ramassage supervisé à Borden. Ce site sera l'endroit où les marchandises, y compris les animaux de compagnie, peuvent être... c'est le 10 février, je m'excuse. Il y aura un lieu de dépôt et un ramassage supervisé à Borden. Ce site sera l'endroit où les marchandises, y compris les animaux de compagnie, peuvent être échangés. Les tests sont un pilier clé de notre stratégie pour limiter la transmission du COVID-19 à l'île du Prince-Édouard. En vigueur, immédiatement, lorsque c'est possible, je demande aux travailleurs par rotation et aux camionneurs d'attendre de recevoir leur premier test négatif à l'île du Prince-Édouard avant de rejoindre leur famille quand c'est possible. Et les vacances de mars, je sais, les étudiants inscrits à des études postsecondaires profiteront bientôt de la semaine de lecture et il est fortement recommandé aux étudiants de l'île qui étudient dans des établissements postsecondaires hors de l'île de ne pas rentrer chez eux pour la semaine de lecture. Tous les élèves qui retournent à la province pour la semaine de lecture devront isoler pendant 14 jours ou quelle que soit la durée de leur séjour dans la province selon la période la plus courte. Et pour les familles de l'île qui envisagent la relâche scolaire en mars, le moment n'est pas venu de quitter l'île pour des raisons non exceptionnelles. Je ne prévois pas que cet avis change avant le mi-mars. Encore une fois, veuillez envisager d'explorer l'île du Prince-Édouard et de soutenir les attractions et les entreprises locales pendant le congé de mars. OK, merci beaucoup.
Thanks, Dr. Morrison. Well, last week I asked for your patience throughout this vaccine process, and we've come through some technical difficulties over the past week, but we're well on our way with booking the current priority group. An update from Dr. Morrison's numbers as I got as of 11 o'clock this morning, we now have more than 2,750 people aged 80 and over who have been given 2 appointments for their vaccinations through the vaccine call-in line. We do have 10 phone lines open, and our staff are working as quickly as possible to receive calls and book both vaccine appointments. We'll be continuing to book individuals over the coming weeks, and while we appreciate the anxiousness some have in getting their appointments as early as possible, please know that everyone will receive an appointment before the vaccination clinics begin on the week of February 22nd. We will have online options to facilitate bookings as well in the near future, and we do expect to have an online form available later today, which will allow people aged 80 and over to request a vaccine appointment online. If you fill out that form, you'll receive a call back from our booking clerks before the clinics begin to arrange your date and times for your appointments. If you are having challenges getting through the phone line due to the call volume, please consider using the online form. It will be available later today on the government website. We continue to offer testing at our COVID-19 testing clinics, and we thank Islanders who continue to be tested when they have symptoms. Our clinics were closed yesterday due to the weather, but they're open on their normal schedule today. Thanks again for your patience as we continue to move forward through this vaccine rollout, your understanding and kindness, and as well as your attention to the public health measures. Thank you.
Thank you, Marion, and we'll open it up for questions.
Gabrielle Trumont, Radio-Canada.
Bonjour, Dr. Morrison. Alors, ma question en français, ça serait par rapport à ce système de prise de rendez-vous pour la vaccination. On sait que certains insulaires font étape d'un long temps d'attente pour prendre un rendez-vous. On sait aussi que les travailleurs par rotation, ils vont être contactés aussi par téléphone. Donc, on sait que vous éprouvez quand même des problèmes techniques à ce niveau-là. Est-ce que vous prévoyez utiliser cette même stratégie de prise de rendez-vous par téléphone tout au long de la vaccination ici à Lille, ou vous analysez quand même d'autres possibilités, d'autres stratégies pour organiser la vaccination et accélérer le processus?
Bonjour, Gabrielle. Alors, Marianne vient de mentionner qu'on explore d'autres options. On a le plan d'avoir la possibilité de faire les bookings pour les vaccins sur ligne sur le site web. Alors, ça, je pense, peut-être va commencer bientôt. Alors, ça va beaucoup aider beaucoup de gens dans les mois qui suivent aussi. Aussi, commence aujourd'hui, comme Marianne a mentionné, la possibilité de laisser avec une forme le nom et qu'on peut organiser le vaccin. C'est difficile de regarder trop en avance, mais on commence à parler avec des cliniques avec grand nombre de personnes. À ce moment, on reçoit seulement un petit nombre de vaccins vraiment chaque semaine. Alors, on peut seulement faire les vaccins à un certain nombre de personnes. Mais quand on reçoit plus de vaccins, ça va peut-être changer qu'est-ce qu'on fait et on discute toutes les possibilités avec vraiment les masses cliniques avec beaucoup de personnes. Mais ça change vraiment dépendant sur le nombre de vaccins qu'on a. Ça va peut-être aussi changer quand on reçoit d'autres vaccins qu'on peut garder à 8 degrés parce qu'à un moment donné, on peut avoir peut-être une option quelques mois maintenant d'avoir les vaccins aux pharmacies. Alors, c'est toutes sortes de choses qu'on discute.
Parfait. Et vous avez mentionné que c'est un peu difficile de prévoir les choses si à l'avance, mais je vous pose quand même cette prochaine question. C'est parce qu'on sait que plusieurs membres du secteur touristique à Lille sont très inquiets par rapport à la prochaine saison estivale cette année. Alors, est-ce que vous pensez qu'à cet stade-ci de la pandémie et aussi de l'avancement de la vaccination au pays, est-ce qu'il est possible maintenant d'affirmer qu'on pourrait avoir une reprise de la bulle atlantique ou même l'ouverture des frontières aux autres provinces du Canada à l'été? Est-ce que c'est un scénario réaliste à votre avis?
Ça, c'est la bonne question. À ce moment, je pense que j'ai mentionné en anglais, j'espère d'avoir en premier la boule atlantique au printemps. Et puis, l'année passée, on n'a pas eu avant juillet, alors j'espère que ça va, si tout va bien dans toutes les provinces atlantiques, on peut faire ça ensemble. Et puis, ça, c'est une décision vraiment avec les premiers ministres. Et puis, à part de ça, je pense que c'est trop tôt de regarder vraiment ce que l'été va va nous rendre avec le reste du Canada. On va voir qu'est-ce qui arrive avec la variant, le nombre de cas. On ne veut pas que le pays entre au troisième vague. On veut que le vaccin arrive. On essaie de vacciner plus grand nombre de personnes. Alors, on y pense, on discute, on regarde chaque jour, mais à ce moment, je ne suis pas certaine.
Parfait. Merci beaucoup. Bonne journée.
Bonne journée. The two questions that I answered were really looking ahead about what the vaccine clinics could look like and what options there will be for booking as we get into mass, even bigger mass clinics going forward. So at this point in time, we're only getting a small amount of vaccine in per week, so it's very controlled amount. But with anticipated larger doses of vaccines coming later in the spring, we are looking at what are options of what those mass clinics will look like. We've talked to him, as Mary mentioned, there's online booking, there's phones, there's forms, but there's also discussions with other immunizers and what lies ahead in terms of possibilities for those clinics. And the other question was really what lies ahead in terms of our travel and tourism in the months ahead. And that is a really good question that we consider every day, but we really need to look at our cases around the country, making sure that we're watching with interest what happens with the variant. We know that if we're not careful, the variant can take over as the dominant strain in a country, and that will really influence what happens in this country. Hopeful, as I mentioned, about an Atlantic bubble earlier in the spring and much earlier than we had last year, but that will be a decision with the premiers and based on our epidemiology in Atlantic Canada. And we'll continue to watch and see what that means for travel for outside of the Atlantic region as well, and how many people are vaccinated. And so lots of unknowns, and I know that's challenging for everyone when there is that uncertainty, but as it evolves, we're always trying to look ahead as far as we can.
Brian Higgins, CBC.
Yeah, hi, Dr. Morrison and Nurse Dowling. Could you tell us more about how the online booking system will work? Will there be, for example, extra staff to handle those, booking requests coming online? And perhaps why is it not 100% online to just firm up the booking? Why is that telephone callback required?
Well, we're looking at multiple options, I guess, Brian, and the fully online booking system will come later, as Dr. Morrison said, as we're planning more of those broader clinics and different groups. We really know how much people who are calling line appreciate receiving their appointment dates and times at the same time they speak to someone. But the online request for an appointment really helps us identify those individuals in this current population group who do want to be vaccinated beyond the thousands who we've already spoken to and booked with their appointments. So we're just really looking at multiple options for them. Having the request for the online option of requesting your vaccine appointments does give us the ability for others to support those individuals 80 and above to put that request in and contact people back. But we know some of the individuals in that age category do require support to getting them to medical appointments and clinic appointments, and so often it's family members who may be booking on behalf of someone. And the call-in option is a benefit for those people who can be there with their family member at the time and making sure those arrangements for their appointment times are going to work with their ability for transportation or other issues that they may have. So we're really looking at multiple options, and we will have a future option for a fully online booking system where people can go online as well and actually book and choose their appointment times on the clinics, but that will come later.
Great, thank you.
Welcome.
Following up on that, what will the clinics, can you tell us about the actual vaccination clinics that will be starting on February 22nd? How many will there be? Where will they be? Things like that.
Sure, we will have clinics set up in 4 communities across the province, and we do have to manage the transportation of the vaccine and the amount that we have, and ensuring that we have those clinics fully booked so there's no extra doses at the end of the day, that we have everyone coming and arriving to those appointments. So they're going to be located in O'Leary, in Summerside, in Charlottetown, and in Montague. And so we'll be setting them up so people will come to the clinic. They do need to have their health card with them, and they'll be registered by our clerical staff. They'll review and go through their consent for the vaccination, receive their immunization at the clinic, and then they will have that usual wait of 15 minutes after their immunization, where they will be in an area that's set up for them to be physically distanced from one another while they have their wait and are observed for that time after their vaccination. They'll receive a reminder of their second dose appointment and be on their way.
Thank you.
You're welcome. You want to add anything?
I was just going to just add a comment because I think I didn't highlight it earlier. We've talked about before our PEI approach to the slow and steady march, trying to get people vaccinated, and I know it's early for the vaccine rollout for the country, but in terms of the provinces, not the territories, because their vaccine went out a little differently, but in terms of the percentage of people who've been vaccinated in this country to date, I think this slow and steady approach is working in that we have the highest percentage of people, I believe, who've been vaccinated. And so that's a real credit to Health PI in terms of running their clinics efficiently with the limited vaccine we have.
Jason Simmons, The Guardian.
Good morning. Question about volunteer firefighters and the vaccination. Just wondering, oftentimes the volunteer firefighters are the first on scene, especially for medical calls, and wondering if they if there's a plan in place, there's been any discussion about moving them sort of up the ladder, so to speak, as far as being vaccinated.
Yes, so firefighters, along with police, are absolutely have been discussed and will be identified earlier in as we move out of this first quarter, but into the second quarter. So that information should be highlighted soon. I think it's probably sitting on my desk to make sure it gets approved for up on the website. But the firefighters should see themselves on that list as soon as I get that available for the website.
And just a follow-up question, Dr. Morrison, you had mentioned the possibility of increased gatherings at both Eastlink Center in Charlottetown and the Credit Union Place in Summerside. I'm sure that's welcome news for fans of both the Charlottetown Islanders and Summerside Western Capitals. Are you able to possibly elaborate any more on that?
Well, I think similar to what we've had in place before, but and probably similar to what they're doing in Nova Scotia. It's really trying to make sure that the cohorts are kept in place, and that there's not mixing between the cohorts, and also that and that's really important for the entrances and the exits, how people get in and out of the building, but also around shared washrooms and sort of separate concession stands, for instance. So we need to look at this. We know that they did a very good job in the fall, and We just want to make sure that we're careful and work with them, recognizing that there would be only a few places that would be able to still accommodate the physical distancing, the separation of those cohorts, separate entrances and exits, for instance, and those are really where we would be looking to talk to them and look at their plans again as to go above the multiple gathering limits that are currently in place.
So it's possible, I guess, that their crowds could increase going forward?
It is possible, but in very controlled setting, and that's and I think they're certainly aware of what we were trying to do previously, and we're just going to have another look at those plans to see if they can get a few more people in, but do so safely, with no mixing at all of those cohorts. Right now, as you know, there's a cohort of 50 plus an additional 3 cohorts allowed in rinks, for instance, and but if there's a space that will allow for separate entrances, exits, and enough sets of washrooms, et cetera, we'll have another look at that to see if in those 3 facilities that I mentioned, and those are the 3 that we're very aware of, if that's possible, we'd certainly like to work with them.
Great. Thank you.
You're welcome.
Louise Martin, CBC.
Oh, hi there. Good afternoon to both of you. I think maybe I'll ask you both this question because I'm not sure who would be the best to answer. It's just about some of the maybe, lessons learned so far with this, with the 80-plus priority group with vaccinations and looking ahead to the general public clinics. Can you give us a definitive answer on, when that online booking system will be launched, what it will look like, how many more staff you're going to have to hire to, potentially, book thousands more of these vaccination appointments?
Maybe I'll start, Louise. So we are looking at next week to have the online booking system up and running, which will actually help reduce the number of staff we need to support that booking. Public then and the priority groups that are identified would be able to go in and book their appointments directly online. So we're looking at some testing of that system and making sure that it's functioning over the coming days. So we're hoping next week if things are ready to go with that. So really looking at that option, helping us a lot as we move forward. And as Dr. Morrison said, we're still really discussing the various options that may come to us with respect to the types of vaccine, what the cold chain looks like for those types of vaccine, where they'll be located, engaging with community pharmacies as part of our rollout to the community as we go forward and what that will look like. So there are lots of discussions happening because the information continues to change, and we wanted, with the 80-plus group, I guess, to be able to get this out there and offer people those appointments as soon as we could. So this phone option with our staff booking directly into a different booking system that's not online and wouldn't be able to be put online is really trying to get people their appointments and get those clinics organized as quickly as we could out to those groups. And that did create its challenges, only having sort of a single point of a phone system, even though there were multiple staff there, to be able to have the right phone system that would function for the volume of calls it would receive. So I think we've learned some things, just as we had when we have gone through the many scenarios throughout this pandemic, the first of which being that Islanders respond immediately and are extremely engaged in this whole process, whether it's consistently complying with the public health measures and the rules that have been put in place, requests to be tested for population groups, and now again with our vaccine program. which is what has created our success really throughout this whole pandemic and our ability to be as open as we are in our community right now with sporting activities and everything else happening, schools being opened, all of those things have been extremely positive, and that is because Islanders respond. They have been following the guidance that has been coming out all along, and again, they're doing that with the vaccine, which will only help us all as we move forward. So we do appreciate that it requires that patience as we work our way through, but we do want to reassure everyone they will get their appointment, and we will get you, and we have some time before those appointments start. But we didn't want to wait if we felt we could offer some of that, because we know those groups are very anxious to receive that appointment and know they will get their vaccinations. So that's what I'll add, and Dr. Morrison can comment further.
Hi, Louise. The only thing I'll add is just, I think we're so pleased that so many people 80 years of age and older obviously want to be vaccinated. And so I think that's really positive right off the top. And we are, compared to a number of other jurisdictions, probably offering vaccine to those 80 years of age and older a bit earlier than some other places. And now we're doing that concurrently with other groups as we try to get them vaccinated. But it's, so I think overall it's a good thing. But obviously, we learn every single step of the way, I think, as we've gone through this. And maybe, like in hindsight, could we have said only those 85 years of age and older to start with, and for the first couple of weeks, and then gone to 80 to 85? Again, I think we didn't expect quite as many people to be on the phone the first day, but I think thanks to Health PI for working through those issues.
Thank you. And I know, Dr. Morrison, you mentioned nurses in Abequid and Lennox Island are really leading the efforts to plan the vaccinations in those communities. Health PI is working with the Native Council. Are there any more details on how the vaccination clinics will work in Indigenous communities? Will they be actually in the communities? Just a few more details on that if you have any.
Yes, I think there'll be more communications materials about those clinics in the weeks ahead, but those clinics will be held in those two communities. And for instance, some of the nurses who are going to be administering vaccine in those clinics have already been vaccinated, of course, to make sure they're also covered. So it's, I think they're looking forward to those clinics, and they are planned for later this month.
Thank you very much.
You're welcome.
Laurent Rigaud, La Voix acadienne.
Bonjour, docteur Morrison. J'avais une question par rapport à l'isolement et la situation globale au Canada. Vous avez dit que la situation s'améliorait, que ça va un peu mieux avec les hospitalisations en baisse. Ici, à l'île du Prince-Édouard, on va assouplir certaines restrictions. Mais en même temps, pour l'isolement, vous avez un message un peu plus strict, notamment le fait que les gens ne peuvent pas partager une cuisine ou ce genre de choses. Est-ce que vous pouvez nous expliquer pourquoi vous êtes un peu plus strict sur l'isolement aujourd'hui?
Bonjour, c'est une bonne question. On est plus strict à propos des règlements vraiment avec l'isolement parce que on sait que les variants qu'on voit au Canada maintenant et partout au monde, ils se transmettent plus rapidement avec moins de contacts et ça va vite et c'est plus facile de transmettre. Et parce qu'on ne sait pas en premier si vous avez un variant et peut-être vous n'êtes pas de symptômes. Alors, c'est tellement important d'isoler sans les autres personnes. Et on voit ça avec les autres familles au Canada qui essaient d'isoler loin de l'autre, mais ça transmet assez vite. Alors, c'est pour cette raison, on est assez strict à propos on discute isolé d'une manière assez différente à propos à cause de la variante.
Et juste un follow-up sur cette question, par rapport à la personne qui est aujourd'hui malade, que vous avez annoncé aujourd'hui, qui est en dehors du Canada Atlantique, qui va faire l'isolement dans une autre province. Est-ce que cette personne, quand elle va revenir à l'île du Prince-Édouard, elle va devoir s'isoler à nouveau 14 jours?
Oui, alors il doit suivre les mêmes sortes de règles à propos d'isoler, même si il vient de finir son isolement là-bas, parce que c'est vraiment l'ordre dans la santé publique.
OK, merci.
Okay. I'll try to translate those two questions. One, with some loosening up of measures, why am I talking today about being even stricter around the importance of isolation? And that has a lot to do with the variant, where we know the variant transmits, what we're learning about it is it transmits quickly, more quickly, it transmits easily. And they're seeing it in other places where someone in a family, for instance, has been trying to isolate away from others in a household, but it transmits more rapidly, seemingly more efficiently, and we're trying to avoid that, and that's why that discussion around more strict isolation. And the other was a question around the person who has been identified as an island resident who tested positive for COVID outside of the province, and they're finishing their 14-day isolation. Would they have to isolate when they come back here? And the answer is yes. They'll isolate according to our public health legislation. So I think that's it. Thank you very much.